Can you tell me your name and which hospital you work at?
Jean Ross, Jeanross, and I worked for 36 years at Fairview Southdale.
Okay, so what are you guys doing here today? What do you hope to accomplish?
What we hope to accomplish is to let the employer know what it's like to not have nurses in there to take care of their patients, and to let them know that we'll do whatever it takes to get what we need for our patients and for ourselves.
Do you really feel like patient safety has been compromised because of the levels of staffing between, nurses and patients? I mean, that's one of your main concerns, right? Is the ratio, right?
Absolutely. Patient safety is compromised every day, every shift. And when the hospitals say that their ratios or what they have for the number of nurses for patients is better in this state than others, that's true. And that's due in part to the nurse group and what they've been able to achieve. But it's from fighting every day, every shift to get the levels that we need. We want an assurance now, a guarantee. We know how many we need, and we want to start from there and work up.
Right. So is your top priority, staffing, or what about wages and benefits? I mean, how's that play into everything?
It's true that they have come on the attack for our pension, and they've offered us nothing as an increase, and we still do have a nursing shortage in this country. It's looming and it's getting worse. So obviously, you don't want to move backwards. When it comes to pensions, these nurses, we have fought for these for years. When I was little, nurses were actually, retiring in abject poverty. We worked really, really hard for those pensions. And now, for no reason, literally no reason, those employers want to take it away. I don't care what the rest of the economy is doing right now. Healthcare is doing well. They have the money, and we're not going to let those kinds of things go. If you want to get nurses and keep nurses, they need to have adequate pensions.
Well, you bring up an interesting point. There is an acute shortage of nurses in this country, but yet hospitals have said, and I'm only repeating what they're saying, that it is a tough economy, admissions are down, and also they're facing cuts in Medicare payments to hospitals, and of course that state program for the poor, that whole issue, the General Assistance Medicare Fund, I'm sure didn't help either. So maybe how do you respond to their claims of economic hardship?
They're always anticipating
on the phone. Everybody should
cuts
come in.
in their profits. Always. They're always anticipating cuts in admissions. Sometimes on some given days it's true. We have plans that we've got in our contract that they've agreed to that allow them to flex up and down right now. Plans that we've agreed to, not plans that they insist how they handle us.
Right.
Okay? So when it comes to their anticipated decrease in income, what they're really saying is they don't like the amount of profits they've got now. They want those profits to continue and to go upward. And they're doing it on the backs of the nurses. And there's no reason for it. There's no excuse for it. They have the money. They wouldn't be building and adding on if they didn't.
Why do you think there's such a acute shortage of nurses in this country? I mean, why is it so hard to find adequate numbers of qualified nurses?
There are many, many more things. We're still a predominantly female profession, and there are many more things that women can do now as opposed to when I first started.
Right.
And so you add that to the fact that once you get in, and it's a culture job about the kinds of conditions in which we work and the shortage that we have. When you do have nurses, but they refuse to bring them on because it cuts into their profits, then you get disgruntled nurses, you get dissatisfied nurses, you get nurses afraid that they're going to lose their license, that they're going to maim or kill somebody.
So is there a lot of turnover then within the nursing ranks, especially in hospitals?
There would be, and I think we have been able to stave that off here in the state because we have good union contracts.
Right.
And the benefits are one of the things that hold nurses there, which is another reason we do not want to let them go. And employers, in the long run, that saves them money. They know it. They know it in their hearts, but it's not enough to dissuade them from forcing us into doing this today.
So I know this is a 24-hour strike. Have you guys thought that far ahead? Let's say that, they don't come back to the bargaining table or it's still at an impasse. I mean, what's going to happen next? Another 24-hour strike or what?
We'll do just what we did for this one. We'll sit down, we'll discuss it, we'll vote, and we will decide. But we have lots of options.